Hypertension or high blood pressure is the #1 risk factor for death in the entire world. Each 5-point rise in blood pressure increases your risk of death by about 10%. Why? Having too high of a blood pressure for too long leads to cardiovascular disease, kidney disease, and stroke, and all of these bring you closer to death. So let's find out in greater detail why hypertension is so problematic. When you slap on the blood pressure cuff, you get a top and bottom number, the systolic pressure and the diastolic pressure. The systolic pressure indicates how much pressure your blood is exerting against your artery walls when that heart contracts. The diastolic blood pressure, the bottom number, indicates how much pressure your blood is exerting against your artery walls when the heart relaxes in between those contractions. 50 years ago, there were about 50 million Americans who had hypertension, and now it's 100 million. So why is it so hard for so many people to get that blood pressure down? Lowering the blood pressure numbers is actually the easy part, right? Because I could prescribe you 5 different pills, but that would cause all sorts of other problems. Those side effects would likely entail making you feel either weak, tired, lightheaded, dizzy, even fainting sometimes, muscle cramps, electrolyte abnormalities like high or low sodium or high or low potassium levels, depending on the medication, not to mention the risk of allergic reactions. Now, in general, lowering blood pressure is a good thing, but there's still a 1% risk of death for doing so. A good example is when older people, when they're taking blood pressure medication, they can faint and hit their head and die of a brain hemorrhage, or they can have a fall and they can break their hip. After all, falls are the leading cause of fatal and non-fatal injuries in older adults. So there's a reason why there's increased mortality in older adults whose blood pressure is less than 130 as a result of taking blood pressure medication. And it's no wonder why people want to lower their blood pressure without having to resort to medication. But is that even possible? Absolutely, for most people anyway, and I'll come back to that in a little bit. Most people in the United States who are being treated for mild hypertension, defined as a systolic pressure of 140 to 160, or a diastolic pressure of 90 to 110, are taking some form of medication. But patients with mild hypertension show no benefit from reduction in blood pressure in terms of number of strokes, heart attacks, and death. And fixing the numbers doesn't fix the person, because fixing the numbers isn't fixing the root cause of the problem. And here's the thing, the conversation that we are having, most doctors are not having this conversation with their patients. Mainly because most doctors are too pressed for time to have extensive conversations about preventative medicine. It's easier just to prescribe a pill, isn't it? If you want to look at a country that did a great job of reducing blood pressure and reducing stroke, take a look at the UK, the United Kingdom, where they had a 40% drop in stroke rates between the years 2006 and 2012. Now, did they decide that they just prescribed more blood pressure pills? No. They forced food companies to decrease the amount of salt allowed in processed foods. Now, this worked because they targeted, or at least partially targeted, the root cause of the problem. The FDA, they recommend that we consume no more than 2.3 grams of salt per day, and for those with hypertension, no more than 1.5 grams per day. Now, any guesses as to how many grams of salt most Americans consume on a daily basis? 6.9. But what about way back in the day when our ancestors, they didn't have freezers or refrigerators? They had to salt cure their meats to preserve them. Now, they consumed over 15 grams of salt per day. Does that mean that their blood pressure was through the roof and that they were dying of stroke left and right? No, because healthy kidneys are quite capable of getting rid of salt from the body by dumping it into the urine. But the kidney's ability to get rid of salt from the body, it diminishes when there's too much insulin resistance going on. Now, when people have high insulin levels, they develop insulin resistance, and that causes the blood pressure to go up. So eating a low sodium diet will help lower the blood pressure, but it's only a partial fix. Now, there's 2 main reasons why added sugar from processed food raises the blood pressure. One is because that higher fructose load from the added sugar that ends up being rapidly absorbed and delivered to the liver, where in the liver it gets metabolized. Now, in that process of being metabolized, that produces more uric acid, and that's not a good thing. When this happens, there's less nitric oxide that's produced. So when there's less nitric oxide circulating in your blood pressure goes up. Now, the second main reason is that consuming added sugar leads to higher insulin levels, which causes there to be more smooth muscle in your arteries of your heart and your kidneys, which means your arteries, they start to narrow down, and that's going to cause the blood pressure to go up. Now, this also leads to heart disease and kidney disease as well. So the ultimate solution is to cut out processed food. In doing so, you'll cut down not only on the sodium, but more importantly, you'll cut down on the added sugar, which contains a lot of fructose. Now, doing this will improve and possibly fix the insulin resistance, which is the root cause of the problem.